I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's topic is gallbladder disease is a risk for people on estrogen. So we hear that people on estrogen have a greater risk of gallbladder disease. It may be as much as 2.5 times a baseline risk, but remember that baseline can be fairly small, but we do see this. So what is your gallbladder and what does it do? What are the symptoms of gallbladder disease, and what can you do about it if you are on estrogen? So let's start out by looking at the gallbladder, where it's located, and what's near it. My cadaver partner in medical school used to start every anatomy lesson by saying, where is the nose? So if we look at this slide, the liver is the pinkish organ that you see in the left upper quadrant of the slide. Actually, it's in your right upper abdomen, and the nose is way up north. So let's look at these structures. The liver is the triangle-shaped organ in pink. The gallbladder is the olive-shaped organ below it. It's actually underneath it. It's linked to the liver by a number of duct systems that empty out bile, which then go into the gallbladder for storage. Below that, we see the salmon-colored small intestine. This is called the duodenum. And then to the right, the yellow organ is the pancreas. Now, this is not drawn to scale, and the pancreas actually will extend nearly all the way across the abdomen, from the right upper abdomen to the left upper abdomen. What does the gallbladder do? Well, as I mentioned, the gallbladder stores the bile that is made in the liver. Bile dissolves fat, so it's important in digestion. Triggered by hormones like cholecystectomy, the gallbladder empties bile into the duodenum, or small intestine, and this bile aids in digestion. Now, if you have your gallbladder removed, you can live without a gallbladder. So what can go wrong with a gallbladder? Well, there are a number of things. First of all, we most commonly hear about gallstones. Now, gallstones are made from precipitated bile. It's the cholesterol precipitating as small stones and stored in the gallbladder itself. These little stones can get stuck in the ducts when the gallbladder contracts and empties the bile into the small intestine. It can obstruct the cystic duct, the common bile duct, or the head of the pancreas, that's the pancreatic duct. And any of these structures, depending on the severity of that obstruction, can cause a great deal of severe medical complications. So what are the signs and symptoms of gallbladder stones or slowed gallbladder emptying? First of all, we have right upper quadrant abdominal pain. Now that pain can be reflected into the upper back, usually on the right, although sometimes in the mid-back. The pain can also be referred up to the right shoulder or even the right armpit. And it's interesting when people come in rarely with armpit pain and we're thinking gallbladder, it must seem odd for a patient to see us making that link. But that's the phenomenon of referred pain. People can get nausea and vomiting. They can have a colicky pain. They can have symptoms occurring after they eat a rich meal. And then in complicated cases where the pancreas becomes inflamed, there can be jaundice, fever, rapid heart rate, even fluid collecting in the abdomen called ascites. You can see how the symptoms of gallbladder disease or pancreatitis, an inflamed pancreas, can mimic the symptoms of a pulmonary embolism or blood clot in the lungs. So what do you do if you have these symptoms and are on estrogen? Well, first of all, knowing the symptoms of gallbladder disease, you can take them seriously if and when you recognize them. See your doctor or other healthcare provider. And if symptoms are severe or if you feel as though you are very ill, go directly to the emergency room. Gallstones can require surgical removal of the gallbladder. That's called cholecystectomy, and most frequently that's done through the laparoscope as a laparoscopic cholecystectomy, or the keyhole surgery. Asymptomatic gallstones are usually left as is. They can't be removed themselves, but the entire organ is simply left as is. So that's the information I have today on the gallbladder and the fact that there's an increase in risk for people who are on estrogen. I hope this information was valuable to you. If it was, please like this video, share it with people who might benefit from it, and please subscribe to my channel if you haven't done so already. Thank you for watching, and I'll see you in the next video.